Hi, I'm Dr. Vivek Bansal. I'm a senior consultant here in the Department of Radiation Oncology at ApolloCBCC. I have around 25 to 28 years of experience in this field and have been trained and have mastered the technique of most of the advanced treatment techniques used in the field of radiation oncology. First of all, there are two extremes of this. One where the patient is diagnosed with cancer and we have to reveal the diagnosis. Other is the patient is almost going to in the last few days or weeks which are left with. So both the situations we'll have to explain, because accepting that you are having a cancer is something which is very difficult for patients and their relatives to accept, but in a way that they can understand in the simple language. And first of all, we reveal the diagnosis to the relatives, and later on take the patient itself in the confidence that this is, you are having this cancer and this may be properly cured or controlled by the proper treatment. Hence that is something which helps us to conquer this. Whereas at the same time, for the patients who are in the end of their life, I think their most important thing is to make them more comfortable and try to relieve their sufferings. Hence the pain, nutrition, these are two things which are very important. Third, the team, as a team, the psychologist also plays a very important role to counsel them and relieve them of their anxiety and whatever they are suffering from. So these are the very important things that we have to answer the patients. And most important, cancer does not mean end of life. It is something where 8 out of 10 patients, even in the late stages, they are being cured of disease. Hence the proper treatment and the proper guidance helps. Hence the message for my patients today is, please do not be afraid of cancer. They need to be, you will be cured if you are being diagnosed and treated properly. Yes, it affects us personally because we also go through the ups and downs in our life, but especially for young children diagnosed with cancer, parents, the anxious parents, and how to explain to them how they are going to go through the line of treatment and all that. It is a phenomenal job. That is something which is, I would like to answer in a way that it is something which we have ourselves won the battle. Patients, they have gone to miseries of pain, sufferings, financially they have gone, their parents, especially for children, they have gone through different problems financially, time, physically, psychologically, nutritionally. But at the end of the day, if you see that they have done well, the smile on their face makes a world of difference when it comes to that they are cured of this disease is phenomenal. You are feeling that you have won the battle, you are at the top of the Mount Everest, and nothing else that smile, the feeling that this young child has become okay, or advanced cancer is doing so well during the treatment and the response scan shows they have done well. That's a phenomenal thing, the feeling which only one can understand when you have been involved in their sufferings, and you have been involved in their day-to-day management, and that the fact that they have done well. So it's a really beautiful feeling which one can, and the satisfaction at the end of the day, when you go to your home after all that tired, big, heavy day, that satisfaction you live with is something which is phenomenal. Treating children, pediatric children, is something which is a tough job, because child sometimes does not understand what they are going to go through. At the same time, the parents do have to be conveyed that what this child is going to go through. So I remember I have treated many patients, young children, a brain tumor we call as medulloblastoma, where you have to treat the whole brain and the whole spine. The problem in this young, that 7 years, 8 years, the girl which I am mentioning about, is that she is going to, everything is going to get affected. The brain, the memory is going to get affected, the intelligence is going to get affected. She is not going to conceive, she is not going to have periods, hair fall would be there, and she will not be having the hair regrowth also. So telling the parents and the child, of course we don't tell the child this part, but we have to tell the parents their acceptance, the fear, that how will this young girl would come up. I have that, the young girl which we have treated in the past, and yes, their intelligence get affected. They are generally, what this young girl was topper in their class, and we tell them that slowly as she goes become okay, her intelligence, her memory would get affected, is something which is something very difficult, and they all had to go through this phase of treatment. But fortunately, at the end of the day, this child has done well. This 15 years now, she is free of disease. She is reasonably doing well in her classes also, and I have no track as far as whether she has achieved her periods or not that, but till the last follow-up, she was going well. She touched your feet, and that makes your day, that, sir, I am okay because of you. That's something phenomenal, and I remember her face, smiling face all the time.